Hi, dear students. Good morning, one and all of you. My name is Rasne Somnath, lecturer from Pravara Medical Trust, College of Pharmacy, Shivgaon. My subject is pharmacology and toxicology. In previous lecture, shown that the unit that is drugs acting on blood and blood forming organs. That unit consists about the 5 chapters, that is drugs affecting coagulation of blood, then fibrinolytic agent, then antiplatelet drugs, then third chapter drugs effective in iron deficiency anemia, and second last chapter drugs effective in megaloblastic anemia. This chapter covered in today's lecture. We will be discuss the new topic, that is drugs effective in megaloblastic anemia. The various drugs are used in the treatment of the megaloblastic anemia. So one by one discuss here the megaloblastic anemia. Introduction. Megaloblastic anemia is also called as the microcytic hyperchromic anemia. In that, iron deficiency anemia, that is called as the microcytic hypochromic anemia, but in megaloblastic anemia, that is called as the macrocytic hyperchromic anemia. In this type of anemia, means megaloblastic anemia, there is defect in the maturations of red blood cells. In that megaloblastic anemia, that having defecting in the maturations of the RBC cells. In this case, immature and large size of the red blood cells, and that is called as megaloblast, and that are released into the circulation. So that is called as the megaloblastic anemia. But hemoglobin formation is not defective. But in that having megaloblastic anemia, in that condition, that is immature RBCs and large size of RBCs, but do not affect the hemoglobin production and hemoglobin formation. Then this type of anemia का होतो हो anemia, यामध्ये एकतर immature RBC होतात किंवा large cells of the RBCs होत आहेत, म्हणजेच मेगॅलोब्लास्ट तयार होत आहे. तर मग हा मेगॅलोब्लास्ट अॅनेमिया का तयार होतोय, तर this type of anemia occurs due to the deficiency of vitamin B12 and folic acid. जर बॉडीमध्ये हा अॅनेमिया कधी होणार आहे, that these anemia are produced or occur due to the deficiency of the vitamin B12 and folic acid in the body, so that creating or producing or occurring the megaloblastic anemia. Both vitamin B12 and folic acid are the necessary for nucleoprotein synthesis. हे जे काय दोन विटॅमिन्स आहेत, फॉलिक ॲसिड असेल किंवा विटॅमिन B12 असेल, these are the necessary for the nucleoprotein synthesis, म्हणजेच DNA synthesis. Their deficiency and leading to defective DNA synthesis. जर यांची जर कमतरता असेल तर ऑटोमॅटिकली जे काय DNA तयार होणार आहेत ते डिफेक्टिव्ह तयार होतील, डिफेक्टिव्ह DNA synthesis. And these in turns affect rapidly multiplying cells in the buccal cavity, tongue, gastrointestinal tract, vagina, ovaries and testes or etc. जर हा डेफिशियन्सी बोथ फॉलिक ॲसिड अँड विटॅमिन B12 ची जर असेल तर मेगॅलोब्लास्टिक ॲनेमिया होईल, आणि मेगॅलोब्लास्टिक ॲनेमिया झाला तर त्यामध्ये टर्न्स टू दॅट रॅपिडली मल्टिप्लाइंग द सेल्स इन द बकल कॅव्हिटीमध्ये जे काय RBC सेल्स आहेत त्या इन्क्रीज होतील, टंगमध्ये, त्यानंतर गॅस्ट्रोइंटेस्टायनल ट्रॅक, व्हजायना, ओव्हरीज अँड टेस्टिस यामधलं जे काय मेगॅलोब्लास्टिक ॲनेमिया प्रोड्यूस होईल ह्या पार्ट्समध्ये. सो देन Next slide, vitamin B12. Vitamin B12, it is also known as cyanocobalamin. This vitamin B12 belonging to the groups of cobalamines. हे जे काय vitamin B12 आहे, it's a group of cobalamines. It contains a cyanide groups attached to the cobalt atom. These vitamin B12 are cyanocobalamine that containing the cyanide groups, and this cyanide group is attached to the cobalt atom. Source and occurrence of vitamin B12. Vitamin B12 is synthesized by microorganisms of the colon. Vitamin B12 जे आहे, it's synthesized in our bodies in the colon part, because that having a present in the microorganism, and that microorganism are the produce the vitamin B12. This vitamin B12 is synthesized by using microorganisms in colon part. These colon part are the small intestine parts, small intestine, large intestine, and then colon. This part having a produce that having present the microorganism, and that produce the vitamin B12, but it is not absorbed there, and it is eliminated in feces. It is not absorbed in that position, and so it is eliminated in feces. Commercially, it is obtained from Streptomyces griseus as a byproduct of streptomycin. जर आपल्याला कमर्शियली किंवा एक्सटर्नली जर बॉडीमध्ये इंजेक्ट करायचं असेल विटॅमिन B12, तर दॅट हॅविंग प्रोड्युसिंग बाय द Streptomyces griseus. These are the byproduct of the streptomycin, and it is mostly present in non-vegetarian food like liver, kidney, fish, and egg. These vitamin B12 are the mostly present in non-vegetarian products or foods like liver, kidneys, fish, and egg. So next point, next slide, requirement of vitamin B12. The requirement of vitamin B12 about 1 microgram per day, and the recommended daily intake is 2 microgram for normal adults. Normal adults साठी daily intake किती पाहिजे? 2 micrograms for vitamin B12. Then 3 micrograms for women during pregnancy and lactation, that having 3 micrograms, and in that children's only 0.3 microgram are preferably or recommended daily intake requirement of the vitamin B12. Then next slide, absorption, distribution, and excretion of vitamin B12. In food, vitamin B12 present in metabolically inactive and bound form. जे काय फूड्समध्ये विटॅमिन B12 आहे, तर विटॅमिन B12 प्रेझेंट इन मेटाबॉलिकली इनॅक्टिव्ह आणि बाउंड फॉर्ममध्ये आहे. इट इज रिलीज बाय कुकिंग केल्यानंतर ते रिलीज होतात. विटॅमिन B12 इज ॲब्सॉर्ब ओनली इन प्रेझेन्स ऑफ इंट्रेन्सिक फॅक्टर. विटॅमिन B12ला ॲब्सॉर्प्शन त्याचं डायरेक्ट होत नाही. विटॅमिन B12चं ॲब्सॉर्प्शन होण्यासाठी इंट्रेन्सिक फॅक्टरची गरज आहे. तर विटॅमिन B12 इज ॲब्सॉर्ब ओनली इन प्रेझेन्स ऑफ इंट्रेन्सिक फॅक्टर. Intrinsic factor is a mucopeptide secreted by the gastric mucosa, and these intrinsic factor act as a carrier for vitamin B12. Vitamin B12 is stored in the liver to the extent 99% and some quantity present in the spleen and kidneys. हे जे काय vitamin B12 आहे, that's having a store in the liver in 99% and remaining some quantity present in the kidney and spleen. And this intrinsic factor act as a carrier for vitamin B12. So next slide, it is excreted in bile. These are excretion by using bile, but it is reabsorbed by enterohepatic circulation. The daily urinary excretion of vitamin B12 is negligible. In urinary excretion, it's daily is negligible for vitamin B12. And the total body content is about 5 milligram. Of these only about 0.1 microgram is eliminated. 5 मिलीग्राम आपल्या बॉडीमध्ये प्रेझेंट आहे, पण त्यातून ओनली 0.1 microgram is eliminated, and so the deficiency of vitamin B12 does not occur except 5 to 6 years of prolonged malnutrition. That having the deficiency of vitamin B12 does not occur except 5 to 6 years prolonged malnutrition. Then next slide, metabolic action of vitamin B12. Vitamin B12 is necessary for following metabolic action. विटॅमिन B12 का गरजेचं आहे, तर वेगवेगळ्या मेटाबॉलिक ॲक्शनच्या गरजेसाठी गरज आहे मेटाबॉलिक विटॅमिन B12 ची. विटॅमिन B12 इज नेसेसरी फॉर द व्हेरियस आर फॉलोइंग मेटाबॉलिक ॲक्शन्स. फर्स्ट, इट इज यूज इन methyl group transfer reaction and which is required for the conversion of homocysteine to methionine. This conversion is by using vitamin B12, homocysteine to methionine. Then second use of the vitamin B12 for the metabolic action for the synthesis of DNA, for the biosynthesis of deoxyribonucleic acid. Then for the synthesis of myelin chemicals and to maintain the sulfhydryl groups containing enzymes in the reduced state. And last, for growth promoting effect in birds and animals. These are the metabolic action of vitamin B12 or cyanocobalamin vitamins. Then preparations and doses of vitamin B12. Cyanocobalamin injection are available, and these cyanocobalamin injection are in 50 to 100 micrograms weekly by intramuscularly injection and following by 50 to 100 micrograms every 2 to 3 weeks. Cyanocobalamin injection is available in the dose of 50 to 100, and these 50 to 100 micrograms are the weekly by intramuscularly injection, and त्यानंतर following by 50 to 100 micrograms every 2 to 3 weeks. Then hydroxycobalamin injection are also available, and this hydroxycobalamin injection, the dose is the same as cyanocobalamin, and त्याचा ही डोस एकदम सेम आहे as to that cyanocobalamin. Then next slide, therapeutic uses of vitamin B12. Megaloblastic anemia due to vitamin B12 deficiency. So these vitamin B12 are the used in the megaloblastic anemia. Anemia का होतोय? Anemia due to deficient intake of vitamin B12, then defective absorption of vitamin B12 and defective utilization of vitamin B12, so that having anemia are the produced. Megaloblastic anemia which are produced because that having intake deficiency, defective absorption and defective utilization, so anemia are the occur. Parenteral vitamin B12 is used for the treatment of pernicious anemia. Parenteral vitamin B12 पण दिले जातं because it's treatment for the pernicious anemia. आता pernicious anemia कधी होतो? That having which is due to defective intrinsic factor. इंट्रिन्सिक फॅक्टर असेल तर विटॅमिन B12 चे ॲब्सॉर्प्शन होईल. इंट्रिन्सिक फॅक्टर जर नसेल तर त्या विटॅमिन B12 असून सुद्धा यूज होणार नाही आहे. त्यामुळे इंट्रिन्सिक फॅक्टर इज इम्पॉर्टंट, अँड दॅट हॅविंग इंट्रिन्सिक फॅक्टर हॅविंग अ डिफेक्टिव्ह दॅट कॉल्ड ॲज दी pernicious anemia, and this pernicious anemia that treatment by using parenteral vitamin B12 are the administration by using intravenously. So next slide show folic acid. आतापर्यंत आपण विटॅमिन B12 किंवा सायनोकोबॅलामाइन बद्दल बघितले. आता आपल्याला बघायचे फॉलिक ॲसिड. फॉलिक ॲसिडला अजून काय म्हणलं जातं तर टेरोइल मोनोग्लुटामिक ॲसिड. आता त्याची केमिस्ट्री अँड ऑकरन्स ऑफ द फॉलिक ॲसिड. केमिकली दिस फॉलिक ॲसिड मॉलिक्यूल कन्सिस्ट ऑफ टेरिडिन, पॅरा अमायनो बेन्झोइक ॲसिड अँड ग्लुटामिक ॲसिड. Chemically, this folic acid consists about a various molecule, that is like pteridine, para-aminobenzoic acid and glutamic acid. And the rich source of folic acids are the vegetarian foods like cabbage and greens vegetables. The rich source of folic acid in the which are in the vegetarian foods like that cabbage and green vegetables. However, small quantities are found in eggs, meat, fish and dairy products, and cooking that having destroys the folic acid. Then show next slide, absorption, distribution, excretion of the folic acid. In food, folic acid is present in conjugated form. Usually, it occurs as a triglutamic acid and hepatoglutamic acid conjugate. It is broken down by enzyme known as conjugates present in the gastrointestinal tract. In the absence of conjugase enzyme, folic acid is not absorbed. जसं विटॅमिन B12ला ॲब्सॉर्प्शनसाठी इंट्रेन्सिक फॅक्टर लागत होता, तसा फॉलिक ॲसिडला काय लागतं, कॉन्जुगेस एन्झाईम्स लागतं. अँड these enzymes are present in the GIT tract and it is absorbed mainly in the proximal portion of small intestine, and that having absorption of the folic acid in the proximal portion of small intestine. So next slide, requirement of folic acid. The requirement of folic acid is 100 micrograms for children, 200 micrograms for adults, and 300 to 400 micrograms for women during pregnancy and lactation. This is the requirement of folic acid. Then show next slide, metabolic actions. Folic acid is necessary for the following metabolic action: for the biosynthesis of प्युरिन अँड पायरिमिडिन्स. प्युरिन्स आणि पायरिमिडिनच्या बायोसिंथेसिससाठी फॉलिक ॲसिड गरजेचं आहे. देन इंटर कन्व्हर्जन ऑफ अमायनो ॲसिड. अमायनो ॲसिडचं इंटर कन्व्हर्जन करण्यासाठी फॉलिक ॲसिड इम्पॉर्टंट आहे. फॉर एक्झाम्पल लाईक सेरिन टू ग्लायसिनमध्ये कन्व्हर्जन करायचं असेल तरी फॉलिक ॲसिडची गरज आहे. इनकॉर्पोरेशन ऑफ फॉर्मेट इन टू प्युरिन रिंग्स, अँड ऑल दीज रिॲक्शन्स आर निडेड फॉर द न्यूक्लिक ॲसिड सिंथेसिस. जेवढ्या पण रिॲक्शन्स आहेत ऑल द न्यूक्लिक ॲसिड सिंथेसिससाठी, त्यासाठी फॉलिक ॲसिड्स इम्पॉर्टंट. देन शो नेक्स्ट स्लाइड, थेरापेटिक यूजेस ऑफ द फॉलिक ॲसिड. megaloblastic anemia due to nutritional deficiency. So folic acid are the treatment of the megaloblastic anemia. Megaloblastic anemia of pregnancy and infancy, and some cases of agranulocytosis. These are the uses of the folic acid. So thank you so much.